everyone, I'm Dr. Elyssa from Dental Designs Clinic in Singapore. Welcome to the next episode of Truth or Floss. Here we will be going through some myths or facts about root canal treatment. The first one is root canal treatment is extremely painful. I would say that that's a myth. Root canal treatment is actually the solution to your toothache. During the procedure itself, it can be almost painless. We will first start off with effective local anesthesia after giving you some topical gel on your gums. So if you can imagine, we put some cream on your gums first to numb up the surface, and thereafter when we give you a tiny injection on that side, it will feel almost nothing or at most an end bite. And for patients who are anxious, we can even give you nitrous oxide, which is some happy gas to help you relax throughout the treatment. And before you know it, the treatment will be over. Most of our patients find that root canal treatment is actually almost painless, and if they should have a bit of discomfort after treatment, it settles down very quickly thereafter. So the next one is, once a tooth has a root canal, it does not need follow-up. This is also a myth. So once root canal treatment is done, we will encourage you to return to your general dentist as soon as you can to get a crown done. It's recommended to let the tooth settle down for maybe a week or two. So most of the teeth require root canal treatment because of a bad decay or a deep crack. So if that happens, the tooth will require some form of protection as early as possible. So if you return to your general dentist, they'll place a crown on the top which functions as a helmet, and this will prevent your tooth from fracturing during function when you enjoy your food. In the long run, we will also want to monitor you for root canal reviews. So for root canal reviews, that will be done by a root canal specialist like myself. What we'll do is we'll compare your baseline x-rays to check whether you have any improvement after treatment has been completed. To see visible improvement, it usually takes somewhere between 6 months to 1 year onwards. There is also a minority of the cases where bacteria tends to sneak back after root canal treatment, and these are the cases that we also want to catch during the follow-up. Now, the next one will be root canal treatment is only needed if there's severe pain. So that's not true. Some patients do present with very severe pain because that's a signal of your tooth asking for help. But in some cases, some patients' pain system works a little differently, or their pain threshold is simply too good. They don't feel the pain at all. But their tooth may have some signs of infection, such as having discoloration of their tooth, a gumboil at the side, pus coming out from the gums, or some discomfort on biting. For these reasons, even if there's no severe pain, you do need to seek some attention. Mild discomfort is sufficient for you to require dental treatment. And in some cases, if let's say during a routine checkup, your general dentist advises you to go for an x-ray to check on the tooth, then that's when we can pick up some infections that may have otherwise gone unnoticed. So this is also a myth. Root canal treatment is required once we notice that there is some sort of pain, even if it's mild, or in some cases when there's no pain at all, we still need root canal treatment, because an infection that is quiet now does not mean that it will be quiet forever. It might blow up to cause you severe pain and discomfort, and trust me, that usually happens at the periods of time where you can never find a dentist, such as a public holiday or middle of the night. So yes, we do need root canal treatment, not only when there's severe pain. The next one would be a root canal weakens the tooth and it's better to extract it. I would say that this is a myth because we first have to assess the situation of the tooth. So if a tooth presents with a large filling that's defective, an old crown, or simply a very bad decay causing a large cavity, I would advise us to assess the tooth first to see how strong it is. So we usually gauge how strong it is after removing all the fillings and all the decay. If what's left of your tooth is very weak, then we will not proceed with the root canal treatment. However, if your tooth is quite strong, we will recommend a root canal treatment at the end of the day. So root canal treatment is suitable for teeth that are still worth saving, useful for function, useful for aesthetics. And by doing root canal treatment, it may require some sort of drilling, but in general, it is a very minimally invasive treatment that can preserve the tooth and your smile for many years to come. In most cases, a root canal treatment is better than extraction, because if you were to extract the tooth, you have a new problem. You need to replace that space with something artificial that might not last at the end of the day, and sometimes the alternative solutions are also not good because they might not be suitable for everybody's case, such as an implant or a bridge may not be suitable for you if your bite doesn't allow for it. So root canal treatment is outdated and unsafe. I would say that this is a myth because root canal treatment done nowadays is considered safe, predictable, and effective. So with modern techniques, we have good instruments like rotary instruments to help us clean inside the root canals. We have chemicals that are isolated to the tooth root canals when we are doing the cleaning. We also do all our treatment under a dental microscope, which helps us to see all the narrow areas, missed canals or any calcified areas. We can tackle them predictably. We can also offer you 3D scans, also known as cone beam CTs, such that the root canal treatment can be done without surprises. With such treatment that we can perform nowadays, especially with specialist care, root canal treatment is the way to go and the choice of treatment for patients of all ages. So this is the end of the episode. I hope you all have learned something about root canal treatment, and I hope I've debunked some myths regarding root canal treatment. If you do have any more questions regarding this or anything that you have heard and you're not sure whether it's a myth or a fact, feel free to comment below. See you!